Hi, I'm Dr. Bunnell, and this is Pinellas Vascular. I'm a board-certified vascular surgeon, which means I treat all the blood vessels in the body. Do you or your loved ones suffer from any joint pain caused by osteoarthritis? This is a very common problem in our population. Up to 35 million people are suffering from osteoarthritis pain to date. Well, there are actually ways that we, as vascular providers, can help improve your symptoms. Several years ago, in the early 2000s, studies were performed showing inflammatory changes around the joint space. That inflammation is triggered by ongoing blood vessel development that was never supposed to be there in the first place. An overproduction of tiny channels of blood flow that keeps the inflammation going. So in patients who have osteoarthritis, this inflammation keeps building and building over time. Well, what we found is eliminating the inflammation or stopping the cycle tends to help with the pain significantly. Now, most people are treated for osteoarthritis starting with physical therapy, pain medications, narcotics, which can be addictive and dangerous. They can even undergo steroid treatments and injections into the joint. And when the disease becomes severe enough, joint replacement surgery is also recommended. None of these treatment options target specifically and halt the inflammatory process happening at the joint. And that is why it's very common for people before and after joint replacement to still have pain around their joints because of that inflammation. Well, over the past 10 to 20 years, we've been developing the technology to address this. This treatment is called Genicular Artery Embolization. In this treatment, we are able to use tiny catheters on the inside of your blood vessels to target those nuisance arteries that have built up around the joint that were not supposed to be there and take them away in order to stop the inflammatory cycle. Most people who have this performed are able to stand up and walk around after the intervention with immediate pain relief. The procedure itself is low risk and performed in the outpatient setting right here in the office. Most people can be a candidate for this treatment, but it's important to determine if it's the right option for you. Here at Pinellas Vascular, we're able to help guide you through that process, and if the time is right, offer you the treatment that might change you or your loved ones' lives. Importantly, we've also studied these treatments over years of data and have shown with MRI post-op surveillance that the inflammation and the joint destruction has slowed down or even stopped over time. And as we keep collecting this information, we're able to show more and more the long-lasting great effects of this treatment. So if you or your loved ones suffer from joint pain, I would go ahead and consider giving us a call today so we can see if this is an option for you and help improve your quality of life.